Hello everyone, welcome back to our channel, The Upcoming Doctors. So today here we are going to discuss about the topic from ophthalmology, which is an MBBS third year subject. So the chapter is diseases of orbit, and we are going to discuss the topic, the cavernous sinus thrombosis. So let us get into the topic. So first of all, we are going to discuss this topic under the diseases of orbit, because it is an not a direct topic, but it is actually the complication which actually developed after the infections of orbit. So what exactly thrombosis means? It is a blood clot. Okay, so whatever the blood clots, it's called as thrombosis due to infection. That's why the cavernous sinus thrombosis is actually because of the infected blood clot, and it will manifest as acute inflammatory proptosis. Now what do you mean by the word proptosis? Means the proptosis is nothing but abnormal protrusion of eyeball. So that's the proptosis. Coming to the etiology part, we have the infection from these parts. So you can remember like TENS, TENS. So we have teeth, ear, nose and sinuses, which means the paranasal sinuses. Whatever the infection is present in these parts will be spreading through to the cavernous sinus through the veins in between. So ultimately all the blood in the veins will drain into the cavernous sinus, and it will lead to, along with the blood, the infections also get spreads from the this parts to the, that is teeth, ear, nose and sinuses, into the cavernous sinus, leading to the septic thrombosis of cavernous sinus. But this is the main etiology. Very rarely we see the head injury. Whatever the trauma to the head may also lead to the septic thrombosis of our cavernous sinus. Main etiology is the sepsis. Okay, coming to the communications of the cavernous sinus and the sources of infection. So why we need to learn about this communications means, when we know the communications, then definitely we can know from where the infection is coming, and it is spreading to the cavernous sinus. So through this small diagram we are going to understand about this the thrombosis of cavernous sinus. So we have the orbit here. This is the optic nerve. So we have the superior ophthalmic vein and the inferior. I'll draw with another color. Superior ophthalmic, this is the venous drainage, no, that's why this is the superior ophthalmic vein and the inferior ophthalmic vein, which both will drain into our main sinus, that is the cavernous sinus, right? Okay, so this is the cavernous sinus. After that, here we see these are the anterior part of relation. So we will discuss the communications in 5 parts, which are anterior, posterior, superior, inferior and also medial. So in these 5 parts we are going to discuss the communications. First of all, anterior we already thought, that superior ophthalmic vein and the inferior ophthalmic vein. Coming to the posterior relations, we already have the superior petrosal sinus and the inferior petrosal sinus. This is the inferior petrosal sinus and this is the superior petrosal sinus. Okay, so again this will both leave the cavernous sinus. The posterior relations actually leave the cavernous sinus. They will drain into another sinus, that is called as lateral sinus, right? After that, we have the communications discussed about the anterior and the posterior. We have superior communication. We have the cerebrum and the middle meningeal veins. Through this middle meningeal veins, again the infection can spread from the cerebrum to the cavernous sinus. And inferiorly, this too you see, the projections, which are nothing but the pterygoid venous plexus. So this veins will be having the connection with the face, that I'll explain in the later part, but ultimately they will also drain into our cavernous sinus. So we came to know this communications very briefly. So coming to this is the lateral view, so that we can see the anterior, posterior, superior, inferior communications. Where in the superior view we are going to see about the medial communications. Already explained as the superior ophthalmic vein, inferior ophthalmic drain to the cavernous sinus, which is the anterior relation. So from where the infection comes means, we have the face, nose, paranasal sinuses and the orbit. Okay, whatever the infection is present in these areas, we can see the infected facial wounds, or the paranasal sinus inflammation is the sinusitis, and orbits is the orbital cellulitis. All this will lead into this cavernous sinus drainage and also the infection of the cavernous sinus, ultimately leading to the cavernous sinus thrombosis. Got it? Coming to the next one. Next, relations. Yeah, we are going to discuss about the posterior relations. The posterior relation, superior petrosal sinus, inferior petrosal sinus, and the we again have the labyrinthine veins. The infections from the middle ear, it will through the labyrinthine veins, it will go into the inferior petrosal sinus. And then we have another relation which is very important, the mastoid emissary veins. From this, through this venous drainage, we have the mastoid infection, because mastoid infection may occur in the mastoid air cells, that will lead to the cavernous sinus thrombosis through the connection which is the mastoid emissary veins. So through these communications only our cavernous sinus thrombosis is occurring, that's a septic thrombosis. We already discussed the superior relations also, the cerebral abscess or the meningitis from the veins of the cerebrum, we can get the thrombosis. Okay, so inferiorly, the dangerous area of the face is present, which is a triangular area near the nose and the upper part of the lip, and then the infection spreads through the deep facial vein to the pterygoid venous plexus, which actually shown in the diagram, that will lead to the thrombosis of the cavernous sinus. So this diagram which I explained, that will give the explanation of the anterior, posterior, inferior and the superior relations. Coming to the medial relations, we have to discuss another diagram which is another view. This is the superior view. Okay, so this is the superior view. We can see we have the two cavernous sinuses and there is a connection in between these two cavernous sinuses. This connection is the intercavernous sinus. Through this, the infection spreads from one cavernous sinus to the other cavernous sinus. Actually, this will happen in more than 50% of the cases. This is very important to remember. And then we have again same scene in the superior petrosal sinus, inferior petrosal sinus. Okay, this both, and they will again drain into the lateral sinus. So we have to see in this superior view, we have to see only one thing, that the intercavernous sinus communication is present in between two cavernous sinus, which actually lead a pathway to infect. So if one cavernous sinus is infected, then there is a chance to get another cavernous sinus also infects. The chances are around 50%. Okay. So these are the communications of the cavernous sinus and the sources of infection. Coming to the other part, we are going to discuss about the clinical features, which actually have the general and the ocular features in it. Okay, so coming to the clinical features, here we have initially the condition will be unilateral only, but soon it will become bilateral. Think why it will become bilateral, because we already discussed the cavernous sinus and another cavernous sinus will have the intercavernous communication. That's why from one to another cavernous sinus there will be the spread of infection. That's why it will become the bilateral thing. Okay, and coming to the signs and symptoms, because clinical features includes the signs and symptoms. No, if one eye have the signs and symptoms and other eye also developing the same signs and symptoms, then it is a diagnostic feature of this cavernous sinus thrombosis, because it is going to develop into the bilateral condition, no, from the unilateral condition. Okay, coming to the prior topic, that's the clinical features, general features and the ocular features. We are going to discuss about the general features. The patient will be very seriously ill. Abrupt onset of the high-grade fever also can be present, along with chills and rigors. Okay, vomiting and headache also seen in the case of the patient generally. Coming to the main thing, that's ocular features, we have first of all the cavernous sinus thrombosis is present. So we have the pain in the affected eye, whatever the ipsilateral eye is present, no, we have the pain in that eye. And also in the forehead also we have some pain, that's very severe pain. Coming to the vision loss, because eye function is vision, that's why vision loss is early or late. There will be no any early complication, so there is no any early vision loss. We have the late vision loss. Okay, so conjunctiva will be the swollen and congested one. Proptosis, I already discussed about the proptosis, abnormal protrusion of the eyeball that will develop very rapidly. It is not marked, it is moderate. You have to remember this. I'll say why. It is moderate, but it will develop very rapidly. Okay. So next feature is the ipsilateral ophthalmoplegia. What do you mean by the term ophthalmoplegia? It is nothing but the weakness or paralysis of the muscles, ocular muscles, okay, due to the cranial nerve palsy, that's why. So ipsilateral means on the same side. It will causes diplopia, double vision, because what are the nerves are involved in means the third nerve, which is oculomotor nerve, fourth nerve trochlear, and sixth nerve is the abducens nerve. These are the three cranial nerves which are in relation with the our cavernous sinus. So the third and the fourth nerves are actually directly not related, but they are lateral to this cavernous sinus, whereas our sixth nerve is directly related to the, it will passes through the cavernous sinus. Okay, that's what I said, the sixth nerve which is passes through the cavernous sinus, and third and fourth nerve involved later, because they are actually passing through a cavernous sinus lateral wall. Okay, and ipsilateral ptosis also may be present. This is the dilated pupil we can see, because third nerve palsy is there. No, we already discussed the oculomotor nerve, which is the third nerve palsy. So pupil reflex will be absent. What do you mean by the pupil reflex? Pupillary light reflex means when we throw the light onto the pupil, we can get the constriction of the pupil, because light is falling on the pupil. No, it will try to constrict. That's why that will be absent here, because the pupil is always dilated, and direct pupillary light reflex also gets absent, and ipsilateral one also gets absent. Indirect or the consensual pupillary light reflex is also absent. If you throw light on one eye, the other eye will respond. That's called indirect pupillary light reflex. If you throw light on one eye also, the other eye also will not respond. That's why here we are saying the indirect light reflex is absent. Okay. So another one is the corneal anesthesia, because third, fourth and sixth cranial nerves are involved. Along with that, another cranial nerve, that is a fifth cranial nerve. We know no trigeminal nerve. It have three trigeminal nerve is present, and we have three branches. One is ophthalmic branch, maxillary branch, and the mandibular branch. Here our concern is ophthalmic branch. So ophthalmic branch is actually involved here. So that's why we have the loss of the corneal reflex. That's because of the ophthalmic division of the fifth cranial nerve involvement. So main important point you have to remember is the edema in the mastoid region. If it is present, then you can say definitely it is a cavernous sinus thrombosis. That's why it is a pathognomic sign. Okay. And another one, why because it is getting like this means because of the back pressure from the mastoid emissary vein which is present. So the infection will spread from the mastoid air cells to the mastoid emissary vein. Whatever the pressure will be applied on that in the mastoid region, the edema will develop. That will lead to the cavernous sinus thrombosis. We can find out it as in cavernous sinus thrombosis. Okay. So we already discussed the clinical features, ocular features also we have discussed. So last ocular feature we are going to discuss is the fundus part. Okay. Okay. So fundus part is very important. We have two changes in fundus, the early case or the advanced stage. In early case there will be no any impaired vision can be seen, or there will be normal fundus, there will be no any change in the fundus. But in advanced cases what will happen is the retinal veins will show the congestion, and it will appear as papilledema. This you need to remember. In earlier stages there will be no any impaired vision, no normal fundus will be there. Advanced there will be the retinal veins congestion and also papilledema. Coming to the management part, we already know the management we have to include two headings, that's investigations and then treatment. We have to do the investigations first. So send the blood for the culture to find out the causative organism, so that we can treat according to the causative organism. And CT scan of the head and the orbit also taken, because in the CT scan we can see what is the involvement, what is the extent of the cavernous sinus involvement, and also the proptosis, which actually develops very rapidly. So we can see in that CT scan. And what is the investigation of choice? That's very important to remember. Investigation of choice is a magnetic resonance venography, because the veins are involved. All the cavernous sinus is nothing but venous drainage. That's why magnetic resonance venography, which generally is called as angiography. It will show why you are taking as investigation of choice. It will show the absence of flow of blood, because it is thrombosis. Stasis of the blood is present. There will be no any flow of the blood. Absence of flow of blood. This is the main investigations you have to do. And before going to treat the condition, we need to know small points about the complications and the differential diagnosis. So coming to the complications, at any stage these complications may develop. Please remember this point. At any stage the complications may develop. So hyperpyrexia, because of the fever, already in general features we discussed the fever may be present. That's why the hyperpyrexia. Signs of the meningitis. Why meningitis? In the superior communication we discussed, the middle meningeal veins are present. Through the middle meningeal veins, whatever the cerebral abscess or the meningitis, it will lead into the infection may spread into the cavernous sinus through the middle meningeal veins. So it may lead into the meningitis also, and pulmonary infections. This three are the complications you have to remember. Actually, this cavernous sinus thrombosis is a very dangerous condition. If you don't treat it, it may also lead into the complications and subsequently death also. That's why treating this condition is very important. Differential diagnosis. Why we have to know about the differential diagnosis? Because another two conditions are present which actually resemble this cavernous sinus thrombosis, but we can differentiate with some features. Let us get into it. So first of all, we need to differentiate what are the two conditions. Other two conditions means one is the orbital cellulitis, another one is the panophthalmitis. So already we discussed what is the pathognomic sign of the cavernous sinus thrombosis. Yeah, right. The mastoid, mainly edema, is present in the mastoid region. That will be only present in the case of cavernous sinus thrombosis, which is absent in the case of panophthalmitis and the orbital cellulitis. So we can rule out, no, the cavernous sinus thrombosis can be ruled out from other two conditions. So in panophthalmitis is a unilateral condition, and orbital cellulitis also a unilateral condition. But our cavernous sinus thrombosis, it will starting stages, it will be unilateral, but it can even develop into the bilateral condition subsequently, if the infection is spread from one sinus to the another sinus through the intercavernous communications. So another one is the complete loss of vision. Complete loss of vision can be seen from beginning only in the case of panophthalmitis, where the entire orbit or the entire eye is getting infected and involved. But in the case of cavernous sinus thrombosis, we already saw the loss of vision will be there, but there in the late stages. That point you have to remember. And we already know the general features can be present in the cavernous sinus thrombosis, which are fever, so prostrations, fever, this and all are marked in the case of cavernous sinus thrombosis, which are somewhat mild in the case of other two conditions, which is the panophthalmitis and the orbital cellulitis. So this points, few points you can remember, and you can differentiate the other two from our cavernous sinus thrombosis, right? So we are ultimately going to treat the patient with antibiotics. You can think it is a thrombosis, no, can we give anticoagulants? It's still controversial. Don't go for the anticoagulants, it is still controversial, but you can do one thing. Antibiotics are the mainstay of the treatment. You need to go for the broad spectrum antibiotics. That also the patient is already seriously ill, so we need to give the IV. Okay, intravenously we have to give the broad spectrum antibiotics according to the culture. Already we send the blood culture, no investigation. So whatever the causative organism is present, whether it is most commonly it is a staph aureus. So if it is also resistant, the staph aureus resistant is present, then you can treat with the vancomycin. Otherwise, whatever the empirical treatment also we can start the antibiotics also in prior to the blood culture. So another one is the analgesics and the anti-inflammatory drugs. Analgesics and this anti-inflammatory drugs are given for the pain relief. Okay, control the fever and the pain you need to control. So mainstay of the treatment is antibiotics, analgesics and anti-inflammatory drugs. So at last you have to remember 2 points in the cavernous sinus thrombosis. What is the pathognomic sign of the cavernous sinus thrombosis? Means the mastoid edema. Mastoid edema is very important, the pathognomic sign of the cavernous sinus thrombosis. Another feature is the complications may develop, and treatment you have to give investigation of choice. Yeah, right, investigation of choice is a magnetic resonance venography. Hope you like the video, share the video, and subscribe to our channel. Thank you for listening. Thank you. Stay tuned. Thank you.